Hi guys! Welcome back to my channel. Today's video is a lecture video and I will be discussing hypersensitivity. But before we get started, please click the subscribe button and notification bell so you will be updated for my next upload. And if you are just new to my channel, hi, my name is Yang and I do lecture videos specifically for medtechs and also some vlogs about myself. So if you are interested, go check my channel and hopefully you will gain something from me. So without further ado guys, let's get started. First, we need to know what is the meaning of hypersensitivity. So hypersensitivity guys, it is the heightened state of immune responsiveness. It is an exaggerated response to a harmless antigen that results in injury to the tissue, disease, or even death. The term hypersensitivity is used to describe immune responses which are damaging rather than helpful to the host. So hypersensitivity is based on four different categories. We have type 1, type 2, type 3, and type 4. So first, let's go to type 1 hypersensitivity. Other term for type 1 is the immediate hypersensitivity. The immune mediator is IgE. The immune mechanism is the release of mediators. Example, histamine from basophil or mast cell. It is not involved in complement. So examples for type 1 hypersensitivity or immediate hypersensitivity are anaphylaxis. This is a serious allergic response that often involves swelling, hives, lowered blood pressure, and in severe cases, shock. Another example is hay fever. This is also called the allergic rhinitis. It causes cold-like symptoms such as runny nose, itchy eyes, congestion, sneezing, and sinus pressure. But unlike a cold, hay fever is not caused by a virus. Another example is bee sting. Bee sting venom contains proteins that affect skin cells and the immune system, causing pain and swelling around the sting area. In people with a bee sting allergy, bee venom can trigger a more serious immune system reaction. Next example is food allergies. It is when the body's immune system reacts unusually to specific foods. Some common symptoms include an itchy sensation inside the mouth, throat, or ears. Next example is bronchial asthma. This is another name for asthma, a chronic inflammatory disease of the airways that causes periodic attacks of coughing, wheezing, shortness of breath, and chest tightness. Next example is the wheal and flare reaction. This is a skin allergy test, also known as Prosnitz-Kastner reaction. This is discovered by Karl Prosnitz-Heinz-Kastner in 1921. Next guys is type 2 hypersensitivity. The other term is cytotoxic hypersensitivity. Its immune mediator is IgG. The immune mechanism is the cell lysis due to antibody and complement. So this type 2 hypersensitivity is involved in complement. Examples are, we have transfusion reaction. This is a serious complication that can occur after a blood transfusion. Next example is autoimmune hemolytic anemia. This is a rare type of anemia caused by autoantibodies that bind red blood cells. Next example is hemolytic disease of the newborn. Rh factor incompatibility between mother and fetus. If an Rh negative woman carries an Rh positive baby to term, the mother's immune system can be exposed to Rh positive fetal red blood cells. Next example is Goodpasture syndrome. This is caused by autoantibodies that recognize the basement membrane of the pulmonary and renal blood vessels, resulting in glomerulonephritis and pulmonary hemorrhage. This is usually a disease of childhood. Next example is Graves' disease. An example of anti-receptor type 2 hypersensitivity is observed in Graves' disease, in which anti-thyroid stimulating hormone receptor antibodies lead to increased production of thyroxine. Next guys is type 3 hypersensitivity, also termed as immune complex hypersensitivity. The immune mediators are IgM and IgG. The immune mechanism is the deposition of immune complexes to host tissues, and this is also involved in complement. Examples are serum sickness, an allergic reaction caused by passive immunization of animal serum to humans. Next is Arthus reaction, a localized reaction caused by injection of intradermal soluble antigen causing vasculitis. Type 3 reactions and accompanying inflammatory injury are seen in diseases such as rheumatoid arthritis, systemic lupus erythematosus, and post-streptococcal glomerulonephritis. Last guys is the type 4 hypersensitivity, also termed as the delayed or cell-mediated hypersensitivity. The immune mediator is sensitized T cell. The immune mechanism is the release of lymphokines from sensitized T cell. It is not involved in complement. Examples are contact dermatitis. This is caused by poison ivy, nickel, and cosmetics. Next example is the tuberculin or the purified protein derivative test, also known as Mantoux test, a skin test for detection of Mycobacterium tuberculosis infection. Next example is the pneumonitis. Hypersensitivity pneumonitis involves inhalation of an antigen. This leads to an exaggerated immune response. So that's it guys for hypersensitivity, and this is the table summary for hypersensitivity. So you can pause the video and take a screenshot of this and use this as your review material. So yes, that's it. Thank you so much for watching. So please be updated for my next lecture video. Bye guys!